in acute central serous chorioretinopathy, new approach in management. CSCR is serous detachment of neurosensory retina with accumulation of fluid. The exact pathogenesis is inconclusive. It's the only retinal disease involving fluid accumulation which is not improved but even worsened by corticosteroids. Therefore, the link between corticosteroids and CSCR combined with the observation with an induced CSCR-like model in the rat following mineralocorticoid receptor pathway activation has prompted the evaluation of Eplerenone, an MR antagonist, in the treatment of CSCR. Eplerenone is a selective aldosterone receptor antagonist. It's a potassium-sparing diuretic with adverse effect of hyperkalemia. It's a randomized prospective comparative case series done over 3 years where the patients with acute CSCR presented for the first time over 18 years of age have been included. All the patients were divided into two groups by alternate random sampling in group A, treatment group, and group B, placebo group, where group A treated with oral Eplerenone 25 milligram per day for 1 week and then 50 milligram per day afterwards till the complete resolution of SRF or till next 3 months, whichever was earlier. But the group B patients were on oral medication of vitamin B complex once daily after dinner. The follow-up period was 3 months. So the data collection algorithm was BCVA on Sillence chart, SD-OCT evaluation for CMT analysis and presence of SRF and serum potassium levels. All these parameters were checked at baseline and every monthly visit till the end of the study. We have total taken 162 eyes of 162 patients where the age was showing adult population with generalized male preponderance. In terms of resolution of SRF, though the baseline CMT was showing comparable in both the groups, but the change in CMT was significantly higher in group A for all the months compared to group B. For complete resolution of SRF, in month 1, 55% of patients achieved in group A compared to 22% in group B, while after 3 months it is 96% in group A compared to 83% in group B. In terms of improvement in visual acuity, again the group A is showing better results compared to group B in terms of BCVA improvement. BCVA improvement to 6.6 was achieved in 72% of patients in group A compared to 49% in group B in month 1 and 96% in group A compared to 83% in group B. After 3 months, the 4% of group A patients have progressed to chronic CSCR, while 17% of group B patients have progressed to chronic CSCR. The change in serum potassium in group B was minimal compared to group A, where significant increase in serum potassium have been seen after 3 months. These are two representative OCT images showing almost comparable SRF and CMT at the baseline in group A and a group B patient. But after 3 months, group A patient is showing complete resolution of SRF, while in group B, there is minimal SRF still been persistent and progression to chronic CSCR. So on discussion, in a study by Venkatesh R. et al. Shown BCVA of 6.6 was achieved by 100% of treatment group and 100% of control group at the end of 3 months. But in our study, the 6.6 was achieved in 96% in treatment group and 83% in control group. Zucchiati et al. Demonstrated a complete resolution of SRF in 80% of cases in treatment group and 25% of cases in control group at the end of 3 months. Sun et al. Investigated the effects of spironolactone versus observation in patients with acute CSCR and found similar results to our study. So although the difference in level of serum potassium in both the groups showed no statistical significance at baseline, but there was a mild increase we have noted in the treatment group compared to the control group at the end of 3 months, which was significant statistically. Eplerenone has a meaningful effect against the inappropriate activation of the mineralocorticoid receptors found in the choroidal vasculature in the patients of CSCR. So the basic motto of our study is the addressing the unmet need, both in terms of SRF resolution and in BCVA improvement. We have shown that the group A, the treatment receiving patients are showing better results compared to the control group. So we conclude that a higher and a faster resolution of the disease was achieved in treatment group in acute cases. Patients undergoing Eplerenone therapy showed lesser propensity of progression towards chronic CSCR with permanent RPE changes. In our study, 14 patients from control group progressed to chronic CSCR, while only 3 patients from treatment group had the same fate, which is statistically significant. So we say that Eplerenone may represent an attractive new first-line treatment option for acute CSCR. These are my few references.